Boom, boom, boom. This is Jared, and I'm back. Man, I'm super excited to do another Warriors Quest show. And man, thank you for joining. Thanks, man. I really appreciate your following because this is a great chance for us to spotlight a kidney warrior who's searching for a kidney donor. Man, again, this is going to be an exciting show. We're going to hear from our special guest. She's going to tell us about her journey that she's had with her renal failure, her kidney failure. But before we do that, I'm going to bring on our co-host. All right, I've got a very special co-host. All right, she's no stranger to the kidney disease community. All right, she is a 20-year kidney transplant recipient. She has also she also fights FSGS. And so I'm excited to bring on Dawn Kirkowski. Here we go. Very special co-host. Welcome. Here we go. Dawn, thank you for coming on to the Warriors Quest show again. How are you?
Great. Thank you, Jared.
Oh, man, you're welcome. Man, we've got a great guest. I met her on Instagram. She's watched some of my other shows. She has a very unique story herself. And just like everybody who has come into this community, all right, even though they all have that common ground, kidney failure, all right, each story is unique and different like a snowflake.
Absolutely.
And it is. And I'm excited to have her get her voice heard, to get her story told. But on Instagram is that's where I got connected with her.
Nice.
And she, on Instagram, it's Haddie_kidney warrior, if I'm not mistaken. Hadassah, help me if
I like that.
Yeah, so help me if I'm mistaken on that, but I think that's right. And anyway, so we got connected on Instagram, and she watched some of my other shows. We got to talking. I invited her to get scheduled so that we could get her spotlighted. And so it's Hadassah Ramika McDonald. And man, I know her transplant hospital is in Birmingham, Alabama. So we're going to bring her on, and we're going to get her story told. But man, how excited are you to hear about her story. This is going to be fun.
Great, great. I heard she has FSGS like I do, so we have a little something in common. So
That's right.
this should be very interesting, but just the same, we all have our differences, and I'm happy to hear about her story and see what we could do to help her out to get a kidney. And we may all be different like snowflakes, but there's nothing flaky about kidney
No,
disease.
there's nothing flaky about it. All right. And please don't be stingy. All right. Smash
Yes,
that share
sir.
button. All right. Share it to
All right.
Facebook, Twitter, Instagram, Snapchat, whatever, Parlor, or whatever that new
Friends,
one's called.
Messenger,
Yeah.
wherever you want, share
All
it.
right. Smash that share button. Okay. Don't be stingy. All right. So we're going to bring her on. Everybody give her a very warm Warriors Quest show welcome. All right. Comment, subscribe, like, all that stuff so we can get this broadcast and reach as many people as possible. Here we go. A very VIP intro for Hadassah. Boom! Hadassah, welcome to the Warriors Quest show.
Hi, Jared. Thanks for helping me. Hi,
You're
Dawn.
welcome.
Hi, Adasa. How are you?
I'm good.
Welcome.
Thank you. Glad to be here.
Hey, so we're going to play musical chairs a bit. I'm going to position you in the middle. Hold on.
Okay.
All right, there we go. Boom,
All right,
just like
working
that.
now.
We got you in the middle.
Awesome.
Yeah. So tell us a little bit about your story. Let's begin maybe with your origin story, because I always like to kind of talk about it as an origin story, because I believe every kidney warrior is a hero because you battle every day. All right. And so 14 years ago, you were diagnosed with FSGS.
Yes.
All right. So I'm going to put you solo. Tell us a little bit about kind of how you found out that you had this and how you were feeling, where you were living. Give us kind of the background story, where your family was at that point, and give us kind of, help us envision how this came to this point right now. Okay.
Okay. I'll take you to the beginning.
All right.
Back in March 2005 is when I married the love of my life. And he's watching now. Hi.
Nice.
And we had a great first year of being married. But during that time, we spent a lot of time in the ER, and we never understood why, what was wrong. But of course, they gave me medication or whatever they thought I was dealing with and sent me home. Still didn't know what was wrong. Swollen feet, swollen face, the symptoms of end-stage renal disease. Didn't know it though.
Mm-hmm.
So in April of 2006 is when we left New York City, because my husband and I, we didn't want to raise our children in the city. We wanted to move to more of a suburb area. So we moved to New Jersey. We moved to a small town in Sayreville.
All right.
Yes. We loved Sayreville. That's where our children grew up. So while we were moving, I was wondering why I was so extremely tired and very fatigued, and the move was not really pleasant for me at all. And so I think it was a few weeks after we moved in, I was late, and I told my husband, I said, I think I need to take a pregnancy test. So my husband went to the store. He got 2 of them. My husband took one just to make sure that it was accurate.
All right.
That's what my hubby does, you know.
All right.
So, okay, his test was negative, mine was positive. So we knew it wasn't a bad batch. So we went to the doctor to make sure, you know, that the pregnancy test was accurate, and it was. But the look on the doctor's face was one moment smiling, and then the next, you got a lot of protein in your urine, Mrs. McDonald. And my husband and I looking at him like, what do you mean? Like, what is protein? I mean, I thought protein was a good thing. And they explained to me that no, that signs of your kidneys are failing. And they said, you won't be able to be a patient at this clinic. We're going to have to send you to a high risk clinic. So it was a bit of a bittersweet moment for us. One moment we find out that we're going to be parents, which is the most wonderful thing ever.
Right.
And then the next minute we find out my kidneys are failing.
Right.
So we rushed to the other clinic, and they, because the hospital we came from sent the results over, so we didn't really have to do a lot of paperwork. So they immediately set me up with an appointment. And on from there, it was ultrasounds every month and seeing a nephrologist every single, like, we were in the doctor's office. It felt like we were more there than we were at home. Because they had to keep a close eye on the baby and myself.
Okay.
So it was double appointments, the OB and the nephrologist.
Oh, wow, double. Yeah, because you had to see both of them each time. Okay.
Yes. We have so many ultrasound pictures. It's crazy. Like, it's so crazy. But it was a rough pregnancy, a very rough one. I remember my 21st week, I regular OB checkup. My husband parked the car, and then it was a flight of stairs in order to, you know, we had to climb a flight of stairs in order to get to the doctor's office. So when we got there and they took my vitals, the doctor came in. He was like, okay, Mrs. McDonald, you got to leave here right now. You got to go to the ER and have them admit you. He told my husband to take me straight there. My blood pressure was 200 over 180. It was so high.
Wow.
The doctor was like, no, I will see you over there. Okay, that's what he said. And he said, Mrs. McDonald, you're not going to leave the he said, you're going to leave the hospital with your baby. And I was only 21 weeks into pregnancy.
Wow.
So they immediately admitted me. And I was in the hospital on bed rest, developed gestational diabetes.
Oh, wow.
Okay. So on top of that, I was getting insulin. You know, it was so many things happening to me. And still,
That's a lot all at once. Yeah.
Pretty overwhelming.
All at once. And I just maintained this, you know, this drive to just fight for my kid. You know, I was like, I was really, you know, feeling her moving me, and I'm talking to her and I'm saying, I'm going to do this. I'm going to fight. I didn't give up. I didn't want to give up. I mean, I have to tell you that it's not easy being in a hospital for almost 3 months. It's not at all. And just being in a hospital, not being able to go outside, and you know, it was difficult. But I had, during this time, my mother, you know, was such a tremendous support for me. She took, you know, she was there. She made meals, I think, for my husband at the time. I was in the hospital. She even came to visit. And
Wow, very nice.
my mother
Beautiful.
is ill herself. So getting out is very tough for her. But she made sure that she did. She came to see me a few times. And um, my husband was there with me by my side the whole time. He
Wow.
worked
Wow.
and he worked and
What a gentleman.
he is
Great husband.
I I'm gonna get to I'm gonna tell you guys more about him. I have so
Uh-huh.
many great things to say about him. And when I was there 21 weeks, I was admitted, and then fast forward to 34 weeks.
Mm-hmm.
That morning I felt a lot of pressure. And I was on the phone with my mother-in-law, and I told her, I said, something feels weird. I don't know. I think I might call the nurse. So I called the nurse, and she came and checked me, and I was already 4 centimeters dilated. I was already,
What?
yes.
For
Wow.
real?
34 weeks. My
Wow.
daughter came. My daughter was like, I'm ready to come out. So my daughter, she came early. They didn't have
Wow.
to induce me or anything. She came on her own.
Oh, wow.
Yeah, she was born Tiana. She's watching too. Hi,
Beautiful name.
sweetheart. She was born 5 pounds, 11 ounces. She was
Uh-huh.
Wow.
healthy. She was just a champ. She saved mommy's life, because if I didn't find out I was pregnant, I would have never known I had nephrotic syndrome.
Wow.
I would have never known. Oh, I forgot to tell you guys how I was diagnosed.
Mm-hmm.
Mhm.
When I was, I think, 3 months pregnant, I had a renal biopsy done.
Mhm.
No anesthesia.
Oh,
What prompted them to do it at that point? Just
They wanted to make sure that it wasn't lupus. They wanted to make sure they wanted to test the kidneys. They
okay.
want to, so they went in through the back, and they took a sample
that's
out.
hurt.
Mm-hmm.
Yeah, it hurt. I know what it's like to be stabbed in the back.
I
Let's put
remember
it that
having
way.
mine, so yeah.
Like literally.
Yeah.
So so yeah, that was very painful. That's when they found out that it was FSGS.
Okay, at that
Yeah,
point.
at that point. I'm sorry I skipped that, but that's what happened. And going back to after I had my daughter, we went home, and that's when they had me on prednisone. And prednisone really messed me up. I
The
had,
wicked prednisone. Oh yeah.
yes, Dawn.
I've had a lot of those experiences that you had.
Woo! The bone pain. I mean, I'm feeding my infant, and I'm
Uh-huh.
having bone pain. I'm crying,
Oh my
wanting
gosh.
to die, holding my child.
That sounds unbearable.
It was. It was. That was the time my husband worked at night, so
Mhm.
it's not like I could hand him the baby and to go cry myself to sleep. No,
Uh-huh.
I had to feed her, and I was in so much pain while I was doing it. And but I rocked through it. I got through it. Yeah, it was very difficult dealing with it, and being a new mom, and dealing with, I was a new mom, and then I have to deal with kidney disease. I'm like,
Mm.
will I be able to really enjoy being this new mom when I'm bombarded with pain, chronic fatigue, nausea? It was so much I was dealing with. Depression, you know, a lot comes with a lot of issues come with kidney disease. It's
You're
tough.
right.
It really is. It's not just physical, it's
Oh,
emotional, it's
very much
mental,
emotional.
It's
It is.
everything.
it's
Mm-hmm.
everything.
Yeah.
And it was so hard. Our life was different. It was doctor's offices all the time. it was hard, but not once did my husband complain. He never did.
He's
He
a
stood
warrior
by
too.
me. He is totally a warrior.
Credit to the husbands. Credit to the husbands and the wives that have to deal with us who have it.
Yes, it's not just us
Important.
going through it, it's them going through
To
it
our families,
also. That's
to
right.
children if we have children, to our spouses, to our partners, because all of us have it if one person has it. It's
That's
important.
right. It affects the whole family. It does. And I'll fast forward to our second pregnancy, which is it was going pretty well. I was taking my meds and certain meds they had to take me off of because of the pregnancy. 3 years passed though, because our children are 3 years apart. I was doing just fine. I was feeling fine up until the 31st week. That's when I got the call. The doctor said, Mrs. McDonald, please pack a bag for yourself and your baby. You're going to have to come in. I thought I was going to experience the whole water breaking in the middle of the night, and then my husband having to rush me to the hospital, trying to fly through every red
Right.
light
You didn't have that
and
the first
everything.
time.
Never had that experience.
Yeah.
But, I was like, okay, I'll come in. That's fine. I did whatever they told me to do because, I know they had my life and my child's life. They took it very seriously. We had great doctors. We had a great team of doctors. We did. We were blessed. And so we went to the hospital and I was admitted and I was showing signs of preeclampsia. So here we go. Another
Oh my
pregnancy,
gosh.
whole nother different problem. So the doctor told me, he said, Mrs. McDonald, if you have another headache, we're going to have to induce. Okay. So I was, oh man, I was like, please, I was praying so hard. I said, I want him to stay in there and have full term, and nope, headache came and it was bad. It was a bad headache. So they rushed me to, the other room and they gave me Pitocin and all that other stuff. That medication made me so sick. It really did. And after hours of labor, and he came, our son,
Oh,
Xavier,
Wow.
our beloved son. Hi, Xavier. Yeah, he came. He was very premature though.
wow. Uh-huh.
He came at 33 weeks, 32 and a half, you might as well say. He was very small. He
Mm-hmm.
was 3 pounds. And he
Wow.
he had to be in the NICU for almost 3 weeks. So it was tough. Leaving the hospital without him. I cried today.
Mm-hmm. It
I
must
was
have been very tough.
telling him about it just today,
Mm-hmm.
and I started crying because every time I think about that, I get emotional.
Must have been hard to leave him behind.
Yeah, and
Yeah.
to see him with all those tubes and
Mm-hmm.
everything, it was very hard. But we got through it. Again, my mother, she stepped in. She had our daughter at this time. At this time, our daughter Tiana was 3 years old, and my mother took care of her while we were dealing with this. It was so devastating. My husband, he told me on the way to work after he left the hospital, because he was sleeping in the hospital again. Like, he was by my side.
Mm-hmm.
And he stopped on the side of the road and he told me that he wept so hard.
Wow.
Because,
That's very endearing.
seeing his wife deal with this
Sure.
and his baby, and it was so hard.
Right.
And, we just been through so much as a family.
Right.
He had to cope also with how he felt.
Yes. And, the creator just had us in his hands, and he just, he got us through this. And, I have to just say about my husband that he is my rock. He's been through so much with me. And this is a man that don't complain. He doesn't I'm telling you, I know he's in the room not liking being put on the spot, but I have to say this, that he never complained. And I'm always asking him, honey, are you okay? Because caregivers, they go through it. They go through emotional and they get depressed too.
They try to be so strong for us, and then they're feeling it inside. They want to cry, but they're holding it together for us.
Yes, they are. Yeah, and I was on Facebook one day, and this was back in 2014. I was on Facebook and I came across American Kidney Fund. They said, submit your story. If you have a caregiver that goes the extra mile, we want to know about it. So I sent them my story.
You did, yeah.
I told them everything I told y'all. I said how he went above and beyond for his wife and his children. And they chose our story.
Wow.
And they flew us to Washington, D.C., and he won the American Kidney Fund Caregiver Award.
Nice.
Wow.
Yes.
Wow.
Congratulations.
Yes.
That is so cool. What year was this again?
2014. Yeah, right. It's here on YouTube.
All right.
I'll have to
you
look
can
at
find the video.
Yeah.
We should look at it and share it.
For real, yeah. I'll have to.
Caregivers are so important. I just did a show with Steve Belcher on Urban Health about caregivers with another couple and the psychological effects on families altogether. It's a great one if you haven't seen it.
Yeah. No. He's my hero. He tells me I'm his hero. I'm like, well, you are mine too.
That's the way it should be.
Yes, indeed. Yeah. A
long journey. He sounds like a great man.
He is. And when I started home dialysis, it was in 2013, I believe. Yes, it was 2013 is when I got the call. I had to go in for an appointment to see my nephrologist. And I remember the car ride to the office was about 45 to an hour. Yeah, because I was in Sayreville, New Jersey, and she was in Princeton, New Jersey. So it was a long drive. Wow. And I remember every month those drives was difficult for me. I got heavily depressed. Imagine. Yeah. I would put in my earbuds, and my husband was like, I ain't talking to her. Just let her have her moment.
He knew better.
Yep. I had a playlist just for that ride.
All right. Very cool.
That's cool.
I remember my doctor, I hope she'll watch this one day, because Dr. Bossy, was the best. She got me through 2 pregnancies. She got me through, and she remained my patient. She remained my doctor until I left New Jersey. This is how many years she was my doctor. And I saw the look on her face when she told me that it was time for dialysis. She said, you're going to have to go and get a fistula put in.
How hard was that for her to tell you that and to give you that sort of instruction? Because it sounds like you guys had a pretty good bond, a good relationship.
We did. We were both mothers. She became a new mother as well. And she was asking me for advice. Whenever I go see her, she would ask me, tips on, with formula and things like that. So we had that kind of relationship, It was difficult because she's, so many years. She's seen me, it was hard for her. And I broke down in her office. I started crying because I knew, this is another chapter.
Yeah.
It was another hill I'm going to have to climb.
Another obstacle, yeah.
I know I'm going to have to get through it like I've been through the other obstacles.
Yeah.
So I got the fistula, well, not a fistula, but an AV graft because my veins are teeny tiny.
Okay.
So they put a AV graft in my upper left arm.
All right.
So it was working fine. Wasn't the best job. Okay, because the technicians had a hard time with it and it collapsed after 2 weeks.
Oh my gosh, really?
Yeah. So I had to go and have another one put in.
Wow.
I have another one in my same arm, but the lower part of my arm. They put in a AV graft. This has been working ever since. So because that was a fantastic surgeon.
All right.
Tripathi, hi, if you ever see this.
All right.
Yes. So it's been working ever since. No problems at all. So I had that done, and I started. I did in-center dialysis for a year.
Okay.
And then one of the, I'm not sure if she was FA, of the clinic, but she saw that I was the youngest person on that shift.
All right.
She saw me. She said, "You're so young. What are you doing here? Have you ever heard of home dialysis?" I said, "Home what?" I said, "They do it at home?" She said, "Yeah." She said, "Do you have kids?" I said, "Yeah, I have 2 babies." She said, "You should be home with your babies." I loved her. She had this bubbly personality. She said,
I love
"You should be home with them." So I said, "Sign me up."
Cool.
So I started home dialysis in 2015, I believe. And my nurse, Joanne Rosenberg, the best. Okay. I love Joanne. She taught my husband, she saw that my husband was so good at what he was doing. He was cannulating me very well. He cleaned the machine. He operated the machine very well. She said, "How would you like to be a dialysis technician?" He said, "Okay." So he applied. Yes, he's a dialysis technician and been one for 5 years.
That's awesome. So cool. So because of maybe how he was picking it up so easily, understanding it easily, she thought he'd be just a really good technician, and kind of asked him, and now he's a dialysis technician. Wow.
Yes.
That's fantastic.
5 years.
Yeah.
Wow.
Yes.
Now you're the best technician in the house.
Yes. Yes, it's awesome. He's really good. His patients love him. They love him. Whenever he go on vacation and he come back, they're like, "Oh, we're happy to have you back. We missed you."
It sounds like they love him.
Yeah, they do. They do. They do. I wish you guys could meet him, though. I really do. So
well, I'm going to show a comment here. Looks like he's commented again. I already showed, his comment where he said it was not fun earlier, but it sounds like he's made another comment here. I'm going to share that. So yes, my career is her fault.
You're welcome, dear.
That's funny. That's pretty funny.
Yeah, so yes, home dialysis is much better. I mean, because I see that more and more of us are becoming younger and younger that's developing kidney failure. I mean, I remember my last time in center, I saw so many young people there. And I remember talking to one, we developed, a friendship.
Okay.
And I encouraged him to do home dialysis. I said, maybe you should try and do it at home. And because he was a student and everything. So, I'm not sure if he did because we moved, I went back to home hemo at it because I was kind of going in and out. Sometimes I wanted a break. I wanted to, because when you do home dialysis, it's great, but you do feel a little isolated.
Okay.
As opposed to.
I've heard that from other kidney
kind of being isolated a little bit.
Yeah, you kind of feel, when you're in center, you around the patients, And I remember, developing friendships with the
Yeah.
technicians and nurses. And, I loved coming in and just making them laugh and smile and stuff. I always want to be that good patient because I have the highest respect for our dialysis nurses and
Mm-hmm.
technicians.
That
They are
helps.
the best.
They
I'm
You
are.
telling you.
respect them, they'll help you the best too.
Yeah.
Yes.
Yeah.
Oh my gosh. Especially if you got a really good bond and you got a good rapport, man, it means so much when you've got that.
And they'll
Yes.
help you. How old were you when you started dialysis?
Let's see. I think, honey, can you help me out? Could you comment? My mind is a little foggy.
Yeah.
I don't
So
remember the
on your
age.
Instagram, you said that 14 years ago you were diagnosed with FSGS, and around 7 years ago is when you started dialysis. So
Yes.
roughly, let's see, it must have been about 2013.
When I
Roughly.
started dialysis, yeah.
Is that about right?
Yeah, and I was diagnosed in 2006.
Okay.
Mm-hmm.
And
So
another question I had is, were there any earlier signs maybe that maybe red flags, but you didn't know they were red flags if you kind of look back from your childhood or your adolescence on maybe the FSGS, but you just didn't know you had it?
I remember as a child being sick a lot.
Mm-hmm.
I do remember that. I remember as a teenager I was tired a lot, especially in my 20s. That's when the high blood pressure developed.
Don knows what you're talking about.
I had the same similar story.
Yeah.
And I developed, high blood pressure. I was battling it in my 20s, and I started seeing, my face swelling up and my feet swelling up. I remember at work, I had to have like a stool, so that I could put my feet up, as I sat and I did my work. But I didn't know that it was kidney disease. I
Mm-hmm.
just thought, okay, I'm retaining water.
Yeah. Sure.
We got the same thing.
Yeah,
Same,
you
same,
don't.
same exact thing happened without knowing what the heck was going on, and just figured, oh, maybe I'm just like getting this for some other reason. I'm
Right.
just
Allergies.
for
Exactly.
some other thing. There's no other sign.
Yeah, and early on, when I was living at home, with my mother, I remember one night I went to the bathroom and I literally urinated blood.
Oh my gosh. That's
Wow.
I mean, it looked like V8,
yeah.
and it was devastating. I'm like, what the heck is going on?
Sure. That'd be very scary.
Yeah, so I called the ambulance and I went, right, and they kept me for a week. And they said, oh, well, your potassium is really low. But did you check my kidneys? They didn't bother to check my creatinine levels or anything like that. They didn't tell me nothing.
Nobody tells you
That's so
anything, right?
disappointing.
Yeah.
No, but they kept me for a week for potassium levels. That was it. That was one sign, but I didn't know.
Yeah.
I
You
didn't
didn't know, so they wouldn't look.
No, they wouldn't look. No, they just slapped a Band-Aid and sent me on my way.
They treat a symptom, but they don't bother half the time to explore what the heck the symptom is from.
No, they don't.
And they
They
still do
don't.
that. It's terrible.
It's
Yeah.
unfortunate. Yeah. I want to emphasize that I do have so much respect for doctors,
Me too.
nurses, all of, especially in this year, the
Oh
year of
yes,
our
absolutely.
pandemic.
Hats
So
off to them.
I totally want to emphasize that, but I do want to echo what you've said, Dawn. Is unfortunately this is a pattern, and I've interviewed so many kidney warriors that have said similar things, whether it's FSGS or lupus or diabetes or whatever, is that they just weren't given either enough education or there were symptoms that they tried to look at but didn't really try to uncover why they were getting the symptoms and other things. So it just seems to be a trend. you
Well,
know, and
ER treats symptoms. You go in, they see a problem, they treat the symptom, they send you home. They don't try to identify something else. And
right.
I think that's their protocol. It doesn't
Yeah,
make them bad doctors. This
No,
is just what happens when you go to the ER. They want you in, they want you out. And then, depending upon your insurance and other experiences that other kidney warriors have also reported, kind of the similar thing happens, which is why
mhm,
these shows are so important to
they
educate
are.
warriors about what the symptoms are, and it does a great service to people who are just getting started, so they know now if they have FSGS and they see these things. Here are a couple people that can vouch talk to that,
that's right.
and say, hey, let's ask my doctor test my kidneys. It's a simple
Right.
blood and urine test.
That's right. Mm-hmm.
So for
That is so
the
true.
so in the time that I've been interviewing kidney warriors who have FSGS, so in my layman's understanding, okay, it's focal segmental glomer.
Glomerulosclerosis.
Thank you. That's the only part that I have trouble saying.
Please don't ever ask me to pronounce that because I
Yeah,
can't do it.
I'm
I've
gonna.
been doing it so long. I've been
I
doing it over 20 years. It's come
Don,
on.
I practiced it like 14 times today. I thought I was gonna roll off my tongue today, but
I think you gotta have it to know it. I don't
yeah.
know. It's
So
like
so what it is though is it's the glomeruli in the
the
kidneys.
glomeruli, yeah.
Yeah.
Basically, they shrink.
Hmm.
Um,
Yeah,
basically, the glomeruli are your filters, and
Yes.
as my doctor explained to me, they shrink. So your kidneys basically go from like looking like healthy grapes to little tiny
shriveled up
raisins.
things.
They're
Right.
raisins.
Yes,
Yes.
that's
So
what my
they don't
doctor did.
filter
She
both
went
the
like this.
toxins or the water anymore. If
Yeah,
that helps. Does that help a little to explain?
Yes, yes, thank you. Because I've gotten a greater understanding because I've interviewed other kidney warriors who, much like yourself, have FSGS, and I've had to do more research, and I've wanted to, of course, because it's interesting that there are also different degrees or different forms of the FSGS. I'm trying to
Mhm.
remember when I was doing my research, something like. But at any rate, so when how concerned are you, Hadassah, in regards to um, after transplant, how your transplanted kidney may be affected by the FSGS? And Dawn, after she's answered, if I can get your perspective as well.
Sure.
well, I've always been very skeptical. I've been kind of afraid a little bit. That is why some people may say, well, why you take so long to even try and consider a transplant? Is because so many years I was afraid,
Mm-hmm.
because I have, my immune system is attacking my kidneys. So I'm like, if I get a transplanted kidney, will my immune system do the same to the transplanted kidney?
Mhm.
Because
Mhm.
I've spoken with so many other kidney warriors that have.
Mm-hmm.
I spoke to one lady who had 4 transplants.
Isn't that
I think I
incredible?
might even
Yeah,
know her.
you're right.
I said to her, are you human? She started laughing. I said, how did you go through all of that? Like, that's a
Yeah,
lot.
it is.
4. And she has
Uh-huh.
FSGS too. But then
Okay.
on the other hand, there's a dear, sweet young lady that I have had the pleasure to know. She has her own foundation, the Iya Foundation. Iya, shout out to you if you're watching this. She has her own foundation where she provides dialysis to. She's from Cameroon,
Okay.
and
Wow.
Nice. Wow.
she's taking care of her people back home in Cameroon with
All right.
dialysis
Wow.
equipment and
Awesome.
Uh-huh.
everything. She's doing such a great job, and she has FSGS, and
What
she's
is her
had
name?
her kidney. Iya.
Yeah. Okay. I wonder
Yeah,
if
from the
Steve
Iya
knows her.
Foundation. She's
Yeah.
on
You got to find her to
Instagram.
get her on if you can, Jared.
Yeah.
You gotta get her on the show, Jared.
All right. Yeah. Steve
I'll
knows
tell
somebody
her.
from Cameroon. I wonder if he knows her.
Probably do. Probably
Well,
do
that's
because
incredible. So she has her is it a nonprofit or what sort of
I think I think it's nonprofit.
All
I'm
right.
not sure, but yeah,
Does she have a
I
transplant or she's on dialysis?
she had a transplant.
Okay,
Her mother gave her kidney,
nice.
Wow.
Wow,
and I
awesome.
think she celebrated. Oh man, I hope I'm not wrong. I think she celebrated 13 years of
13
or
years.
Wow, hats off to her.
yeah,
Great.
maybe
That's a
more.
great amount of time.
Yes,
That's
she had
awesome.
that transplanted kidney is working strong, and Ia is doing a great job. We did a kidney walk together, you know, and
Nice.
it was fun. She's just so involved in the kidney community.
Nice.
Yeah,
Beautiful.
yeah. So she gave me hope because she really encouraged me. She said, "You
One thing is
should."
you meet a lot of beautiful people through
Yes,
having FSGS and being a kidney warrior. Despite all the troubles, we can meet so many wonderful people if we put ourselves out there.
that's
Absolutely.
right.
It's a
That's
great
right.
community. Hmm.
Yes, and it is. My goal time, you know, my children, like after both my children were born, I was determined to raise awareness. And that's what I
Absolutely.
try to do. That's why we do the kidney walks. That I don't know, with the pandemic, I was really hoping because I know
Yeah.
Birmingham, they do kidney walks out here
See
too.
if there is a virtual one. A lot of
Yeah.
places, like my
Lisa
organ
Baxter did
procurement
a
agency,
virtual walk.
is doing
Yeah.
a
Okay.
virtual walk.
I didn't know
Hmm.
that existed.
Yeah, check that out.
Oh,
Just like, look to see in your community virtual walks. If not, you might be able to help encourage people to set one up. They do
Real,
fundraising
yeah.
okay.
for virtual walks right
Okay.
Yeah, I
I'll
know
do
Lisa
that.
Baxter. She's from Brooklyn, New York.
Yes, I've heard of Lisa
Yeah,
Baxter.
now. Yeah,
she,
yeah.
she did a
There's been
virtual
some up
walk
here in the New York
recently.
area, like the New Jersey Sharing Network, which is my OPO, where I got my kidney through. They do well, they're going to be having the Transplant Games of America, which this year was postponed to 2021. So they did some
Mm-hmm.
fundraisers, virtual cycling
Yeah.
and walks and things. So maybe you can check that out. National Kidney Foundation also does walks, and you can see if they have something virtual.
Oh yeah, yeah. We've done NKF walks in New
Yeah.
York City.
Right.
It was so much
I've done the New
fun.
York City walk too. We
You
might have been in
did?
the same place at the same time.
Oh, that Brooklyn Bridge was something else.
Yeah,
It's fun though.
it's fun.
Yeah, I met Lisa Baxter at
Yeah,
one
she's
of the
awesome.
Nice,
NKF walks. Yeah,
nice,
Uh-huh. Yeah,
yeah.
that's the one that
awesome.
she that's the one that she just did recently is
Okay.
AAKP. Yeah, I think
Yeah,
that's the right one.
yeah,
She just did a virtual one just within the last couple days, I think.
Oh,
right.
nice.
Yeah. So that's
Yeah.
good. Um, yeah, I want to speak to that about the FSGS because well, I'm 20 years out of a transplant with FSGS. So I could understand being upset and being scared. I was not scared because I had no clue that even it could even come back. My doctor didn't tell me that, strangely enough, but it was probably best that she didn't. She told me she just told me how to keep taking care of my transplant, and I didn't even hear that until recently. I heard something, maybe it was on Warriors Quest or maybe something I read, I don't even know, when I went back to her a few years ago and said to her, hey, I have a first name relationship with her because I've known her over 20 years. She's been treating me like, so I understand having that relationship with your
All right.
doctor. And
Yes.
I went, hey, Penny, I said, can this thing come back? I was very nonchalant about it because I
Uh,
already had it about like 16, 17 years. And so I want to address it like this. Just like any of the medications that we take, whether we're on dialysis or have a transplant, our bodies react differently to it. So I want to say that our bodies also react differently to any disease, whether it's
okay.
something
Good point.
similar or the same form. Because I know, like, I have diabetes after the prednisone from the transplant, but not
Mm.
everybody's is controlled differently, and not through any fault of their own. So there are like levels of that. So FSGS also may have levels and different symptoms, and it does depend on the person, the donor, maybe the donor's health. One of the things that I was definitely told by my nephrologist was this. She said, when you get a transplant, early on, the less rejection episodes you have, that there's acute rejection, which is where you get like an immediate response of rejection episode, and then there's like a long-term rejection that happens over time. The
Okay.
more you get acute reactions where it starts to go, the more chances you might have of being able that you should be tested for the FSGS to see if that's the cause. Although that may not necessarily be the cause, because some of the medications we take, if that levels are too high, that can also cause kidney failure in some people. But again, not everybody's the same, and the most
Right.
recent transplants don't have the same meds that I'm on. So again, there's a lot of factors. Also, and they can make just about any matching kidney now, match somebody through blood types. When I was transplanted, it was a little different. We had to find almost the close to perfect match.
Relative, yeah.
Mm-hmm.
Uh-huh.
Right. Well, a relative, or if somebody died, a very close match. So now they're much better with the treatments and the medications and keeping on top of these things where they could indicate a lot sooner. So not everybody's kidneys go back and fail from the FSGS. There's a guy on here. Um, is it Brett Butler? You would know better than me.
Brent Butler. Okay.
That has the
Right.
FSGS, and he's got a
Hmm.
kidney for 43 years. His was a deceased
What?
donor. Yeah.
Wow.
And mine was 20, and I had a deceased donor. So it may not even matter that you get, I mean, yes, a living donor is always better. They didn't do them when me and when both of us, there was, it had to be a relative or you didn't get a living donor back then when him and I
Hmm.
got transplanted, even 20 something years ago.
Yeah.
So people like us are proof that it can happen, and that there are, again, so many factors. Discuss your personal history with your doctor, ask those questions about what they think. But I wouldn't fear so much getting the transplant, because you've already been through so much, had family strength, strength in God, the will to survive, the knowledge to do what is right. If you get FSGS, again, urban health is also very helpful, and other resources, doctors, nurses, even your absolutely wonderful husband. So you kind of know what to do now, because now there are ways that people can control it a lot longer than when I got diagnosed with it, or maybe even when you
Yes.
got diagnosed with it, through diet and other means that we can do. And all we can
Mm-hmm.
do is take the best care of ourselves, no matter what disease that we have, as you did, as I did, and Jared knows. So, there are many of us. The lady who had the 4 transplants, that's a lot less common today. There are more people
Yeah.
sticking with the transplants, even if they develop diabetes or have diabetes along with it. Um, so, I would say have hope. You've already been through so much. If you can do it, if you're not already listed. I would worry less about that and maybe just more focus on the hope of getting the transplant, because you can do very well. You've already got the skills.
Absolutely.
That's very
And
encouraging.
I think you've got a great personality, and I think that you speak with people and people can relate when you're talking, because
Absolutely.
yeah, I love your personality, especially when you talk about being a mother. You could tell just by your voice, your expressions, the amount of love you have for your children when you were talking about your experience, when they were born.
Yeah.
I just think that you've got such a vibrant personality, and I love that.
Thank
So,
you.
one thing you did say earlier, and I want to kind of talk about that briefly before we come to the end of the show, is that you had mentioned that this disease can do a lot for you in a negative way emotionally. I can't remember your words
Yes.
exactly,
I
but
remember you talking about
yeah.
Yeah.
And I want to talk about that because you're right. There are cases where sometimes this can be more emotionally stressful than physically. A lot of kidney warriors go through this. My sister-in-law, all right, she's the one who, has kidney disease, and how I'm connected to this community. She
Right.
went through a lot of emotional, a lot of emotional stress because of this.
Yeah.
Um, I'm I'm encouraged that you have such a great support system, that your husband is such a gem, and that he does so much, and he's such a great caretaker. But what are some things that that you do to stay grounded, so that when there are days that it's overwhelming, or days that maybe you feel the burden? What are some things that you do, whether it's meditation, or what are some things that you both do together or you do alone to help keep your balance?
Every single morning, I do not put my feet on the floor. I do not get out of bed unless I've had a conversation with the Most High. I do not, because it's because of Him that I am here today. It's
Mhm.
because of Him that I have peace, even in the midst. This is a thorn in my side,
Mhm.
is what I look at it as, and it's my Goliath.
Yeah.
That's how I see it. It's
Uh-huh.
my Goliath, and I have to fight it every day. And that sling and that rock, I make
Yeah.
sure I have in my hand so that I can take him down every day.
Hmm.
That's how I see it. I if it was not for my faith in the Most High, I would not be sane. I would
Hmm.
not be here with you today. I would have been given up. I would have been given up. I'm so devoted to prayer. I'm so devoted to reading of the scriptures, and I teach my children the scriptures every day. I homeschool. I've been homeschooling our children for 3 years.
Nice.
So this pandemic, my children was like, "Oh, this is
Yeah.
nothing. We've
No
been
sweat.
homeschooled.
Yeah.
They already been home at school.
Yeah.
We've
No big
already been
deal.
home."
Yeah. We
So
got this.
that's what they said. They
Yeah.
got this, and it's my children too. They're so strong, and they got my back.
They were
Anytime
born
mommy
warriors,
can't,
obviously, too.
yeah, they might, especially our daughter. She's seen a lot. She's seen mommy go in ambulances all her life and things. She's strong. You know, and she knows she comes from a long line of strong women, because I tell you, my mother, my grandmother, strong women. I tell you, my sister as well. I just want to, lost my sister a few weeks ago.
I'm
Oh, I'm
sorry to
sorry
hear
for your
that.
loss.
I'm sorry.
She lost the battle with cancer. So I didn't care about my health. I didn't care about me at the time. I was not feeling well at all, but I made the trip to New York.
Hmm.
You know, I had to be there to support my niece and nephews.
Right.
So, that again, like you brought up, mental, emotional, it was devastating.
Mhm.
I didn't want to do dialysis. I didn't want to do not just want to lay in bed. But I
Yeah.
had to get up again, I had to do it. It's
You just do
it's
it because you
it's the
got to. It's not,
drive.
yeah, you do it
Yes,
because
you
you
want
have
to
to.
live.
You don't think
Exactly.
about it. You want to live. And when your focus is on others, you know you got to take care of your health, or you ain't going to be there to take care of others.
That's right. And I remember my sister telling me that, that you are a mother and you got to press on. She was telling me, my sister, you know, I miss her. And
Family's everything,
yeah,
Yep,
and
absolutely.
yeah.
yeah.
Speaking of
So,
family, thanks for watching, Shannon. She says you're an
oh,
amazing
hi,
mother. Love
Nisi.
you, Auntie.
I love you, Shani.
That's awesome. Having a support system, a family that gives you respect and encouragement, love, is so necessary. And it gives me, so much hope for you when that's happening, because there are other cases where I've interviewed other people, and they don't have a great support system, and it's much more difficult. This disease will put you to your knees on any given day, and
Yeah,
without that support system, it's very difficult.
you
And so
can't do it.
I'm
You can't.
inspired. I'm inspired by your faith. That's awesome that you start out every day the way you do. That's inspiring to me. I'm moved by your faith, and it makes me want to be a better person just by hearing that, and I want to have a better relationship with my God as well, and I'm moved by that. I am.
You
Yeah,
can, all he commands of us is to obey his laws and be obedient, trust in him, believe in the Mashiach.
that's awesome. I'm so glad we did this. We're coming to the end here, but what would I want to put you solo here in a moment so that we can have have you give your shout outs and say what you want to say. But before we do that, I also want to just want to say thank you to Don Kirkowski. Oh man, I've got so much admiration and respect for you, and
Yes.
I'm so glad that you co-hosted tonight. And what would you like to say to Hadassah before you leave? What kind of words of encouragement, or what kind of words would you like to say as a fellow kidney warrior and FSGS warrior?
Well, first of all, I'd like to meet you on Facebook sometime, or have a conversation with you, because you're very inspiring, and maybe we can help each other, because I feel so much about your story in my heart, because I have such similar stories, and really understand where you're coming from.
Wow.
That, and I'd be happy to say a prayer that you do get a kidney soon. I think you have a wonderful personality. I think you can do this. And like I said, and I think that you could get a transplant and be okay regardless of the circumstances after that, with the wonderful support network that you have, the coping skills that you do have, your faith that you can do that too, because you've already been through such amazing hurdles. It's wonderful that you had your children. But I do have a quick question. When you first had diagnosed with renal disease, was there any indications that your doctor said it to you about maybe not having children, or indications that they thought it would be dangerous to have children? Just curious.
No, they didn't.
Hmm.
They didn't. Actually, the only time they said it to me was after our second child was born.
Hmm. Hmm.
Okay.
The doctor
Okay.
said, Mrs.
Hmm.
McDonald,
Hmm.
no more babies.
Okay. Okay. Yeah.
He said,
Yeah.
no more babies.
Yeah.
Uh-huh.
And the thing
Yeah.
is, my husband and I already came to the conclusion. My husband was like, no more. He
Too
said,
big of
I
a
don't want to
battle.
see you go through this anymore.
Yeah.
Hmm.
So we already made the decision.
Okay.
And
Yeah. I
plus,
was
as
kind
a
of told not
woman,
to.
after I had my son, I knew our family was complete. You know,
You just know.
you just
Yeah.
know.
I got warned very early when I wanted to get pregnant. That's why that I really wouldn't be a good option, because they thought I could get preeclampsia because my blood pressures were high. I was
Oh,
already into renal disease. I got my transplant at age 29. So uh, by the time I wanted kids, it wasn't going to be, I was transplanted, but having still some issues. So it really
oh,
it wasn't to be, but that's okay, because here I am looking out for
nice.
other people, looking out
There
for
you
other
go.
warriors.
There you
I'm
Mhm.
also a
go.
mental health social worker. So, if you ever
Wow.
want to talk, I totally understand those feelings that you have. And I want to say that that's
Yes.
completely normal, post pregnancy, as well as with kidney disease, to, have some depression, have some anxiety.
Oh, yeah.
But to know that there is treatment out there if somebody needs professional help. There is treatment out there. I just want to mention that to people. If you didn't need it, all the power to you and God and your family, but some people do, and don't be afraid to ask for it. I want to put that
Amen.
out there for the kidney
Amen to
community.
Oh,
that.
I
Well said.
appreciate that.
Hmm.
Wow. That's great. What you do.
It was my thank
That's
you for my
great.
transplant, to do something
Paying
in
it
the
forward.
community to help others. I now know who they are, but I didn't know, and I wanted to put forth something in the community to help other people. So this is what I do the past 13 years now out of 20.
Wow. Wow. You're so very, I mean, that's very important when you do. We need that.
We absolutely
As
do.
patients,
We
we need
do.
that.
And
Mhm.
families
And
need it.
families too. Yeah.
Family, yeah.
Yes,
You're an
definitely.
inspiration to families as well as to the kidney community.
Hey, I'm going to read a
Thank
comment
you.
here, put a comment up here from Don. Don is saying, Hadassah, please be encouraged and hold on. That kidney is coming. Your faith will sustain you. I've made it 29 years. You aren't
Woo!
alone.
Nice.
And
Congratulations.
Way
thanks
to
for watching.
go. Congratulations,
See, we got
Dawn.
some long timers to inspire
Wow.
you. Awesome.
Yeah.
29 years. See, y'all, I think mentally, I don't think I know. I'm ready for this. I wasn't ready before. I'm ready. I'm
You
ready
know
to
when you
do
are.
this.
You know
Yes,
when you are. That's all.
Yes. The only thing that, because I've been through the process of, getting put on the donors list. I've been through the
Okay.
examination and everything, and they told me I'm an excellent candidate. Is just I need to, lose about 30 pounds, and I've lost, I think, 15 of those
All right.
30 pounds.
Okay.
So I think I need
You're-
more to go, because they concentrate on the abdomen,
yes.
your
They
stomach
put it in your
area.
abdomen. Yes.
Yes.
But
So
that's to be on the transplant list for a deceased donor. You could have, if someone wanted to apply to be a living kidney donor, you could still do it now, right?
You could, but they still may suggest losing the weight because it's not about whether you have a
yep.
living or deceased donor. It's about them going in there and placing the kidney properly.
Yes.
And if there
Uh,
is too much fat around the abdomen,
Yes.
that affects the physicality of the transplant.
okay.
Jeez, I know a
That
bunch of
makes,
stuff I
Yes.
didn't even think I know.
I thought you
no,
was the
that's,
transplant surgeon for a
yeah.
minute, because they said the same thing to me, word for
Uh-huh.
Yeah.
word, exactly what she said.
Interesting. That makes sense.
Over
Yes.
26 years of kidney disease, that's almost half my life. So I listen to them talk. I
Uh-huh.
could be laying on an ER gurney and I'm listening to these doctors talk so I can ask them questions and they think I'm a professional lying in the bed.
Good stuff. That's good.
That's why
Well,
I got to
thank
be out here talking about this stuff. I know some stuff.
no,
Yep.
I'm glad you were able to talk that. That's good. I,
Yeah, you
So
an
yeah, that's what the
expert,
deal is there.
Dawn.
well,
We're
thank you
all
again.
experts. We're experts on our own disease. That's
That's
the important
right.
thing that I want to tell you and people out there is we are experts on our body. Don't let
Yes.
anybody tell you different if somebody's watching this. Tell the doctor what you're feeling. Encourage them to test you. We are experts on our own body. Don't be afraid to tell them because they are not perfect. Respect to all physicians and nurses. God love them.
Right.
We wouldn't be here without them. Especially some that are just going above and beyond. But we got to
Yes.
talk to them no matter how good they are. They're not mind readers,
Right.
and we have to talk to them. We have to be aware.
Yes. And it's so important. It's so important to know your diagnosis, to understand what it is, because sometimes you get a nephrologist, and we've had it. We've had we've had a nephrologist who actually didn't know what FSGS was.
Yep.
Really?
They look at
My
you like you got
husband
three
had
heads.
to
I've heard that before. It's
my
not the
Really?
most
husband
That's
common
surprising.
disease. It's out there. Now I found more people with it, but I think
Yeah.
there was like 150 in the country when I got it. So we gotta. I mean, my mom also has it, by the way. So that's at least two in a family. They thought it was hereditary, but two in a family didn't tell you much back then.
Right.
So yeah, some doctors you go to the ER and they look at you like, "What's your diagnosis?" And then I spell it out for them and they're like, "What did you say?"
Yeah, they don't know. But what happened with us is this nephrologist, he was a nephrologist. He was
Oh,
my
Uh-huh.
that's kind of
nephrologist at the
shameful.
time. And because I had to leave my longtime
Oh,
nephrologist
I
because
can
of
imagine.
my husband had to change jobs and all insurance kind of
Oh yeah,
thing.
it's terrible when you have to do that.
I hate that.
I hate that nonsense. Yeah.
She didn't take the insurance. So this new one we had, he didn't know what FSGS was. So my
That's
husband
so
had to take him
surprising.
aside. My
That's
husband had
amazing.
to
When you more
explain
than
Is
know
he,
more than them.
he didn't
your husband, your
yeah, my
husband had to
husband
talk to him?
stepped in and told him what it was. So I was not happy. Like this is why it's so important to be educated as a patient. You gotta know what's going on. You gotta know your diagnosis, because I don't know how many times I had to school these nephrologists because they talk. I don't like when doctors talk at me. Don't talk
Oh, that's
at me.
rude.
Right.
That's rude
Talk
and
to
obnoxious. You
me.
know
Like you're a
you.
real person. Yeah.
Yes. I don't want, because this is my life. Like you get to, punch in a job and clock out. I never clock out from this.
Right.
This is
No.
every day,
You don't have
every
that.
day for the
Yeah,
rest of
you
my
don't get to
life.
do that.
This is a full-time
Yeah.
job. I'm happy to
24/7,
you're a mom. So
365.
Yes.
yeah,
So moving
absolutely.
down here to
I usually fire
Alabama.
them, by the way, if I have doctors that talk at me. I'm really good for firing doctors. If I
Me
don't feel like
too.
they're gonna advocate for me, and
Me too.
yeah, or they're not giving. It's not about what we don't
I
want to hear. We've
fired
already heard the
3.
stuff we don't want to
You
hear.
fired 3.
Yeah, I fired a bunch of diabetes doctors. I fired a few doctors. If I don't have a team I like, I say bye bye. My insurance has a few other
Oh,
options there.
don't
Your
be
You have
husband
afraid to
has
to.
be
his
the
You
words
have
of
to.
yes.
wisdom. Yeah, don't
That's
be afraid
right.
to be the smartest person in the room when it comes to your health. Yeah, you know your
That's
body.
right.
Like
And if
I
you don't
think
want a
Don said
treatment,
something like that.
because it sounds like it's something, this is good to know for when you get a transplant. If
Mm-hmm.
they give you any new medicine for anything else in the world, you want to research that with your doctor and with the pharmacies and whoever to make sure that it doesn't have a risk to your kidney. Because God
Right.
help us all, literally, because the doctors that treat other things don't know the effect on a kidney transplant. Always,
Mm-hmm.
always ask questions and get a second opinion from your nephrologist. I want to
That's
put that out
right.
there seriously.
I
No, it's
sure
good.
will.
It's good.
I'm going to look you up, Dawn,
Yeah,
because
I'm glad.
Sure, you can
Yeah,
friend me out there at
I'm
Dawn
so
I'm
glad
on
Kirkowski. Sure.
I've
I'm
had you
on
as a co-host
Instagram.
tonight. Yeah.
I'm on Instagram. Look me
Did
up.
I have that right, by the way? So it's Haddie underscore Kidney Warrior. Was that right?
Number 4. Yeah,
Number
Haddie
4. Okay, I
underscore.
almost had it totally right. All
Yeah,
right.
right now I'm just on Facebook. I'm not on Instagram, but you can find me there.
Oh, okay.
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 All right. So
Yeah.
Don, we're running out of time again, but I'm so happy we did this because you have so much in common, and you were able to relate and talk a little bit more about it, because you have that experience, and experience in so many ways
Hmm.
helps people, because especially with Dawn P. Edwards here. Okay, I appreciate Dawn saying what she did, because what happens, it's so instrumental in feeling encouraged when you have support. And
Yes.
when you have so many people, all right, that are giving you support, but not only are they giving you support, but they can relate. All right, they've been through what you've been through, or they're going through what you're going through. And
Yeah.
when they do that, you don't feel alone. Man, it is powerful.
It is.
It is, because then you have hope. And I'll tell you what, hope is so powerful in any language. All right,
Yes.
German, English, Spanish, whatever language, hope is the most powerful word in any
Hmm.
language, because when you have hope, all right, you can get out of bed more easily. When you have hope,
Hmm.
Yes.
you can endure more.
Oh
You
yeah.
can do so many things with hope.
Absolutely.
And that's the one thing that I want to give you today is hope. But again, Don, thank you so much for coming on. I appreciate you, respect you, admire you, and we got to do this again. All right.
Yeah, absolutely, Jared. Anytime I'm free, sure.
All right. Thanks, Don.
Awesome.
Have a good
All right,
evening.
you're
God
welcome.
bless.
Very nice meeting you, Haddie.
Nice meeting you too, Dawn. I'm gonna look you up.
Yeah, you look me up, no problem. I'll touch you. All right, take care.
All right. Thank
All
you.
right.
All right. So, in fact, Don, if you want to stay there for a moment, I'll talk to you backstage if you have time. If not, that's okay. And so we've got Shannon, who also said, sadly, when it comes to some doctors, you have to be the boss and they have to be the employees. And I respect that. I do. Okay. Because sometimes, because you know your own body. All right. Sometimes,
Yes.
even though they have all the experience of being a doctor, nurse, nurse practitioner, or whatever, or a dialysis technician, you know your body. And so
That's
sometimes you have
right.
to say what you have to say. And I love that
Mm-hmm.
too.
Yes. You're so right, Shannon.
Absolutely. I love that. Thanks for your
So
comment.
right. Yes.
So, what I'd like to do is give you a time to, spotlight you here and give your shout outs, any thank yous, shout outs, and then, maybe a plea too of how you would like to have, why you want a transplant, and what kind of life that would give you if you had a transplant. Okay.
Okay. I'll start out by saying what kind of life I think I would have if I had a transplant. First of all, I won't have to worry about dialysis. That's number one. And from what I've been told by other recipients, is their feeling of tiredness and overall nauseating, all of that is gone once they get a new kidney. They pee.
Right. That cannot be overstated.
Hey, I hope it's not too much information, but
No.
I miss peeing.
Right.
I mean, it's hard. Like, so I look forward to feeling better and actually being able to be a better mom. I don't want to be tired. I want to take my children on more field trips and play ball with them. And, a lot of times when they ask me, Mom, you want to do this? You want to play this video game or do that? And I'm like, no, I don't feel like it. I'm always saying, I don't feel like it. But with a new kidney, it'll be, come on, let's do it.
Mm-hmm.
I wouldn't be so tired all the time. It'll be a better life for me as a mother of two young children who need me. So, if I find a donor, that'll be fantastic. I mean, I'm O positive. So, I don't know if that's universal or what. I'm not sure of that.
No, I can help you with that. Yeah. So when you're O positive, you can receive a kidney. The donor can be either O positive or O negative. But when you have O, you have to receive it from somebody who's O positive or O negative.
Right.
Because
Yeah.
O is the universe. They're the universal donor. If you're O and you want to donate, you can donate to any blood type. But when you are O, then you can only receive from O positive or O
Yeah,
negative.
that's the only thing. Yeah.
No biggie though, because the paired exchange program is huge. All right, that's one thing that can really speed up the timeline, and so that's something that I really like. I really emphasize, and I really try to talk about on every show, is that the paired exchange program speeds up the process. Where many times nephrologists, doctors, they tell you, on an average, it's about 5 to 7 years on the transplant list. Well, as you already put very eloquently, I might add, is that your quality of life is going to be better when you're not on dialysis.
Yes.
And so, that 5 to 7 years, if you just wait and you don't try to find a living kidney donor, that 5 to 7 years can be brutal. It's an on and off again sort of roller coaster, emotionally, physically, so on and so forth. And so the paired exchange program, even if you're not type O or O negative, please, when you're watching this video, because this will be on YouTube and you may watch this on a replay, okay, still apply. Call the phone number and apply to be a donor for her, regardless whether you're O negative or O positive, because the paired exchange program statistically speeds up the time, because the UNOS or other organ procurement organizations will help match up with her hospital a match for her, and it speeds up the time tremendously. And so that's exciting about the paired exchange program, is that you don't have to be O positive or O negative. Still apply. The hospital will help her match up the right blood type with somebody else, and they'll do a swap, and it'll be done. I've had people recently that have had the paired exchange program happen, and it does happen, and it can actually lead to multiple people getting a kidney donor. It can be a very,
I
very,
heard about that.
very happy
That's
thing.
cool.
Yeah,
Mm-hmm.
man. So
Yeah.
I'm so glad we did this. You're so refreshing. You've got a vibrant personality. I love your smile, especially with the purple. You're royalty tonight, and I love that. Yeah.
Thank you.
Yeah, you're welcome. So please, let's keep in touch. All right.
Definitely.
And let me know how everything works out, because man, it's been ever since I've started doing this. It's amazing, and I think I said this to you on Monday, but it's amazing how there's a good percentage. I'd have to look it up with the calculator, but there's a higher percentage of people that have been on the Warriors Quest show that move on to get a kidney transplant.
That's
All
great.
right. And so I can only thank, okay, the Most High God, okay, because I really feel as though a number of people praying together, doing more than just prayer, but sharing this. Don't be stingy. Share this. All right. And doing more, okay, because that's how faith works with hope, is that we put things in motion. And when that happens, I really believe that our Creator will make great things happen. And so I'm looking forward to giving you that hope, okay?
Right. Thank you. He's been with me since the beginning.
That's awesome. So glad you have that.
Yeah, that's.
Well, thank you again. All right. God bless you and your family. Happy holidays. And again, hit me up whenever that day may come, and let me know. All right. Keep me posted.
I sure will. I sure will. Thank you for having me on, Jared. Thank
You're
you.
welcome. All right.
Thank you.
Well, and thanks to all of your family tonight for watching and tuning in and sharing this as well.
Thank you. Thank you, guys.
Shannon, your husband.
My husband, my children.
And your children,
my
right.
niece, Shannon, Daniel, King, my nephews. I just want to say because both my nephews told me today, that they were proud of me, both of them. And I was, so, overjoyed so cool. To hear that.
Yeah,
they see that auntie is sick, but yet she's still advocating. My nephew said, I'm proud of you because in spite of what you're going through, you're still trying to educate others.
So let me ask you, this photo that I used in the background here who's the boy that you're hugging?
That's my son, Xavier.
Oh, that's awesome. That's such an endearing photo. Yeah. It really is.
My son, I tell you, he's my hug bug.
That's awesome. That's awesome. That's so cool. Well, again, God bless you. Keep your strong faith that you have. It's going to do more for you in the long run, even on the bad or hard days. Keep it, and I know that you will continue to have success. And I'm so happy to have done this tonight, and I hope to broadcast this on every social media platform that I can. Okay.
Thank you, and all praises to the Most High.
Amen. Amen to that. All right. Okay. Thank you again. Have a good night.
You too. Bye-bye.
Okay. Bye-bye. All right, you guys, man, we've heard from Hadassah. What a story. And then, Don Kirkowski had so much in common with her as well, with the high blood pressure, FSGS, and so many different things. It was good to have Don as a co-host and talk about these things. But when you saw and when you replay this and you look at the emotion, all right, the facial expressions when she's talking about the birth of her children, and when she talked about Xavier at the end when I asked her about whom she was hugging in that background photo, all right, this is a person who loves her family, all right, has such a big heart, all right, and wants to have such an extended life for her family. If you feel inspired as I have tonight, all right, and you feel compassion, please do something. Act on that inspiration for her, okay? I'm so glad we did this. All right, thank you for your support. All right, one of the things I wanted to try out tonight is I wanted to show this. All right, please comment, subscribe, and hit the bell. All right, so if you like it, all right, if you like this, you comment, subscribe, and you hit the bell. All right, especially when you like and comment. All right, it does help get this out there. With the algorithm that YouTube uses, it's going to be more visible. All right, it becomes more visible. The more visible it is, the more people we can reach so that we can get this story out there. It does so much, not only to give Hadassah hope, but for others that are watching this video who also have a chronic disease, kidney disease, or maybe liver disease, or what have you, FSGS, lupus. It gives them hope as well. So please like, subscribe, hit that bell, and continue to share this on Twitter, Instagram, wherever you can. I appreciate all of your comments and everything tonight as well. All right, God bless. I'm going to say peace. I'm out, and I'm going to do a outro here before we do. All right, thank you again for everything. Peace. I'm out. Boom.